one?
I have a doctor's orders for nasogastric tubing to be put in for the patient who was ordered nothing by mouth, and it's for parental feeding. So I got the tape, I got my stuff with me, so I'm ready to go to patient's room. Hello, Mr. Jones.
Hello.
How are you today?
Great.
I'm Elena, I'm a student nurse, and I will be putting nasogastric tube that your doctor ordered for you. Let me wash my hands real quick. Can I please have your name and date of birth?
Tom Jones, 1950.
Thank you. Do you have any allergies?
No, ma'am.
Wonderful. Did you have any surgeries on your nose done before?
No, ma'am.
If you don't mind, I'll check your ears to see for the septum, any septum deviation or patency.
Okay, perfect.
Thank you. Oh, look, Peyton. Can you breathe in for one? For another one? Great, wonderful. If you don't mind, we'll do the right one. Okay?
Yes, ma'am.
So you're in high filer position, so you are good to go. Let me measure our tubing. Starting from the nose, your ear, and xiphoid process, and I'm gonna mark it. That's how far I have to advance the tube. Okay, wonderful. Are you ready to go?
Yes, ma'am.
All right. Sterilize my hands. I'm gonna put my gloves on. Okay. I'm gonna lubricate my tubing for inches. Okay, ready to go. Can you push your head back towards the pillow? Okay, good. Okay, I'm gonna do it slowly, so keep on swallowing, because you cannot sip any water, just keep on swallowing. I'm gonna try to be as gentle as I can. Now I feel a little bit pressure, so if you don't mind pushing your chin towards the head. Thank you. Okay, I don't feel any resistance, so this is good. Okay, I put all the way towards my mark. Can you please speak?
Yes, ma'am.
All right. Let me see back of your throat for any coiling. I don't see any coiling. Great. Let me put tape right here. Try and inspect everything. All right. Okay. Can you? Okay. So I checked. Okay. Let me check for coiling. There's no coiling in the back throat. Okay. And then I'm gonna do the aspirate. Okay, aspirate 10 ml. Color is yellow and it's thick. So I'm gonna put it back. If I have pH paper, I would test my pH. I can also test by putting air into your belly. So if you don't mind, I'm gonna lift up your blanket and listen to your belly. Okay?
Okay, of course.
Thank you. Lift the epigastric area. I'm gonna place my stethoscope, and I have 30 ml of air. So as I push the air, I'm gonna listen.
Mm-hmm.
I hear the bubbles. Okay, good. All right. Of course, I'm gonna get the order, and we get the X-ray done to make sure your tube is in place. Let me stabilize your tube. Oh, that's a great tape I have here. It's a white cut tape, so we're gonna go all around it and going on the other here. There you go, and I have one more going over your nose. Okay, how you feeling? I know it's a little uncomfortable.
Oh, it's
Are you
fine.
doing okay?
Yes,
Good.
ma'am.
Perfect. Okay, so I can now, we are almost done. I can now connect it to the suctioning.
Yes, ma'am.
Wonderful. Well, you're gonna have the feeding, so for right now it's suctioning, I guess. So I would document once I check that my patient is tolerated procedure. I'm gonna go and document what kind of tube it was, size, length, and type, size, and length. Then I'm gonna document how much, what was the aspirate, the suction that I had from the stomach, what color was in consistency. Then I'm gonna document how patient tolerated the procedure, and what teaching I gave to the client. And I told the client that since it's nothing by mouth, so he cannot drink any water when he cannot eat anything. So and that's it. Now I'm gonna move on to my irrigation of nasogastric tube. Actually, I forgot to put a pin on my patient. That's what I forgot to do. So there you go. So when irrigating the nasogastric tube, I would also verify my client once again, position him in a high Fowler position. I'm going to disconnect the tubing, put it on the towel. Then I'm going to check for placement. So I'm going to get, I'm going to aspirate for the contents, and I'm going to put back and check for placement. And then I'm going to get 30 ml of nasal saline of water, and I'm going to put 30 ml of water, and then I'm going to see what is the return, and I would document the difference between intake and output as the input. And once again, as I leave the patient's side, I'm gonna lower the bed, make sure that the bed is in at least 30-degree angle, since he has a nasogastric tube. Make sure that he doesn't want to, he didn't need to use the restroom. All the personal belongings within reach. Lower the bed, pull the side rails up, and then I'm gonna document. Document the amount and color of the nasal gastric secretion, and I'm gonna put type and amount of what I put in, and then